Good afternoon, everybody, and welcome to the 2022 Alzheimer's Association Rhode Island Chapter State House Advocacy Day. We are once again doing this, as you very well know, virtually, and we apologize in that logistics at the State House here on our end and with COVID, etc., have still not quite allowed us to be back in person, but we certainly hope that we will be under the dome next year with all of us live and in person advocating to our legislators. So we appreciate your presence today, and we appreciate most of all everything that you do for the Alzheimer's Association cause, and particularly for our chapter. We are grateful for the advocacy, certainly. We're grateful for the volunteerism you do for us and with us in our walk to end Alzheimer's, in our programs in the community, in sharing the resources that we have to offer for those living with Alzheimer's and for their caregivers and families, and many, many more things that you do for us. We certainly couldn't do it without you. So thank you, thank you, thank you for being here and for everything you do. What I want to do is I want to introduce the boss, the executive director of the Alzheimer's Association Rhode Island chapter, Donna McGowan, for a few opening remarks. Donna, the floor is yours.
Thank you, David. Good afternoon, everybody, and thank you all for joining us today, albeit virtually once again, to be part of our Alzheimer's advocacy community. Your support of our cause is so crucial in waging a joint effort to eradicate Alzheimer's disease and make life much more bearable for those living with the disease as well as their caregivers. Why have an Alzheimer's Advocacy Day? The answer is actually quite simple. Alzheimer's remains one of the most critical public health issues in America, and state governments stand on the front line. State government must address the challenges the disease poses and take decisive action to confront this crisis. That is part of the reason we at the Alzheimer's Association and all of you are unrelenting advocates for public policy that advocates for research and improves access to care and support services. State policy is vital to the work of the association does and to meet the needs of the individuals living with the disease and their families. We so appreciate your participation in today's Alzheimer's Advocacy Day, and I hope we can count on you to take action by sharing with our elected officials and your elected officials how important it is to support our fellow Rhode Islanders facing this devastating disease. We cannot do this work simply without you. We're here for you. The Alzheimer's Association provides a variety of educational programs and support groups, both virtual and in person, all at no charge. In addition, our 24/7 helpline is available to answer any questions anytime in over 200 languages. The number is 1-800-272-3900. Again, that number is 1-800-272-3900. Thank you so much again for taking the time out of your hectic schedule today to be with us and support our actions. And now I'm going to turn it back over to David Carlin, our Director of Public Policy.
Thank you, Donna, so much for those words. And I'm actually going to pass the baton again real quick back to my colleague, Annie Murphy, and the behind-the-scenes facilitator of the event today, Ben Barber, or either or. Ben is working the camera angles and the logistics for us, but they're going to explain to all of us, but to those of you in the audience who are listening or seeing us, they will explain the chat function and how to ask questions and things of that nature. So Annie and Ben, thanks, and take it away.
Wonderful. Thank you so much, David. So during the forum this afternoon, we are asking that if you have comments regarding what you're hearing today, or if you have questions, please fill that information in our comments area, and we will be able to respond to you as quickly as we can. There may be times when a comment or a question comes up that we will need to follow up with you after today's forum. But please, this is an opportunity for each one of you for us to hear the voices of our constituents here in the state of Rhode Island. So thank you so much.
Absolutely. And Annie, if you are watching on Facebook, just put it directly in the comments. And if you are watching on YouTube, you're going to want to put it in the live chat feature, not in the comments. So the live chat feature, if you're on a desktop, is going to be over on the right. And if you are on your phone, the live chat feature should pop up. But if not, it should be right under the video in the options. Just click live chat, and there you have it. And then David will be hosting a Q&A at the end. So, and that is going to scroll at the bottom the entire time. Thanks, Annie.
Thank you.
Thank you very much. I appreciate that. For those of you who would like to take advantage of asking questions or would like to comment in the chat, please, as Annie and Ben just said, feel free to do so, and we'll get right to you. We hope. I hope. It's my great pleasure now, on behalf of Donna McGowan and on behalf of all of us at the Rhode Island chapter, to introduce a very, very special guest. This person will no doubt not be a stranger to you. For the last 12 months or so, she has served as the Lieutenant Governor of the state of Rhode Island, and she has done as the chair of the Long-Term Care Coordinating Council, which has quite a bit to do with Alzheimer's and related dementia, and setting forward a state plan along with the Alzheimer's Advisory Council. She has quite a lot to do with our cause on a regular basis, but she is also out there in the community on behalf of her office and on behalf of the office of Governor McKee. And it is now my pleasure to introduce, for greetings from the state of Rhode Island, the Honorable Sabina Mattos, Lieutenant Governor of the state of Rhode Island. Governor, welcome.
Thank you. Thank you, David. Thank you so much for your kind introduction. I'm truly blessed to have this opportunity to be here with all of you. I want to thank you for the work that you have been doing. I want to thank Donna for everything that she's been doing this past 14 or so months in which I have been in this role. I have been amazed to see the work that all of you have been doing to make sure that we create more awareness about the Alzheimer's disease in our community, and also for us to make sure that we advocate for resources and make sure that we support those caregivers that have been working so hard, taking care of their relative family members, and also those that work in the field of the care, making sure that they're providing the care for our loved ones that have dealing with the challenges of Alzheimer's. I want to recommend my support and the support of the Office of the Lieutenant Governor to the work that you do. I'm very excited about some of the things that we have been doing in the coalition's meetings of the long-term care coordinated councils, but more specific, the subcommittee on Alzheimer. I'm very excited about the work that we're doing now, connecting with the research within the minority communities, and I'm looking forward to being a voice and an advocate and an ally with you in this work. This is something that's affecting all of us. Everyone, regardless of your background, has been dealing with maybe have a friend, a relative, in many cases, someone really close to you that have been dealing with Alzheimer. And we have to make sure that we advocate for more resources for research, more funding for the caregivers, and to make sure that we provide a better quality of life for everyone dealing with Alzheimer. So I'm honored to be here with all of you, and I recommit myself to working with you to make this work a reality every single day through my office. Thank you.
Thank you so much, Governor.
Thank you, David.
There we are. I'm unmuted. Sorry about that. The magic of technology. Thank you so very much, Governor. And for those of you in the audience who might not know, and by the way, Governor, I shortchanged you by a couple of months. You were appointed as Lieutenant Governor 14 months ago in April of 2021. So yes, more than a year. I know it seems like a recent development, but for those of you in the audience who might be interested, might not know this fact already,
Mhm.
the governor is breaking barriers. By the way, we do also, I want to mention, we do call the lieutenant governor when we see her in person. It's the formal way to greet the lieutenant governor. So some in the audience might be thinking, why does he keep calling her governor? But it's the way to address the lieutenant governor. But anyway, the lieutenant governor is breaking barriers all around. When she was elected to the Providence City Council, where she served prior to being lieutenant governor, when she was elected to the council in 2011, she eventually was elected by her peers on the city council as president of the Providence City Council. And she was the first Latina to hold that position in the history of the city of Providence. Then we fast forward to April of 21, and she became the first Latina to hold the position of lieutenant governor in the state of Rhode Island. So, Governor, again, we thank you so very much for being with us, and we thank you for everything that you have done for the Alzheimer's community and for the Long-Term Care Coordinating Council, and indeed the state of Rhode Island as a whole. So thank you for being with us again.
Thank you, David. It's been my pleasure and my honor to serve the state of Rhode Island in this capacity. I'm looking forward for the work that we're going to continue to do together. Thank you.
Thank you so very much. At this point, what I'd like to do, and I keep saying I'd like to do it because it truly is our honor to have these special folks who are with us this morning. First, the lieutenant governor, and now an introduction. And Ben, I may need to ask your assistance backstage for this one because it might be that Karen and Susan, who I am about to introduce, may not have access to the link that you and I are on. They may be on the
They're all good.
link.
It's all,
They're
it's all,
okay. All right. See, again, the magic of technology, and this is why we have the great Ben Barber working with us behind the scenes. But I'd like to introduce two very dear colleagues to the Alzheimer's Association Rhode Island chapter, two ladies who have become very good friends because of their experience with Alzheimer's disease. And these ladies not only serve in an advocacy role for us here at the association and at the chapter, but they also serve in many other roles. They are active in education, they are active in training, they are active in sharing their messages, what brought them to the association. They're active in fundraising, and they do so much more that we would probably need another half hour just to list their accomplishments with us. So it is my very great pleasure, again, on behalf of Donna and on behalf of the Rhode Island chapter, it is my great pleasure to introduce Susan Hartson and Karen Friend to share their advocacy stories. Susan, Karen, welcome and thank you.
Thank you so much. Sue, if you don't mind, I can go ahead and start here. We are so grateful to be invited here. And I've been doing Zoom for work for quite a while now, but it still feels very strange not to be speaking to an actual audience. So I'm going to assume that there are thousands listening to this right now and go from there. But we are thrilled to for the folks who are participating. And thank you, Governor, and for that explanation from Dave. And thank you to everyone from the Alzheimer's Association. I think a lot of people have already heard my story. I can briefly say that my late husband passed away about 6 years ago from early onset Alzheimer's, which was really quite devastating. He was an athlete and an engineer, and it really just took that completely away from us. And dealing with it at a young age, he showed signs of it actually in his 40s, which was pretty shocking. But what I will say on top of that is that in some ways, I wish I weren't speaking to you, because I was hoping 6 years later, there would not be a need for me to do this. And there is still such a pressing need. We are still shy on treatments. There are a few, they are not all that effective, particularly in the moderate to later stages, or they are not accessible to a wide number of people. And so we're just so grateful for everything that our Rhode Island legislatures have been doing, because I feel like I'm speaking to the choir a lot of times with Rhode Island. We're such a progressive state in supporting everything related to Alzheimer's, but we still need to press on. There needs to be treatments. There needs to be a cure. People need to not be isolated. And I think that when it came to dealing with my personal situation, and Sue can speak to this as well, we thought that the physical symptoms were going to be really what did us in, and we were never going to be able to deal with the physical symptoms. But on top of it are very disturbing looking psychiatric symptoms that you just don't expect from someone you've been living with for years. Screaming, anger, all kinds of things that just sort of come out of nowhere as the brain is being destroyed by this horrible illness. So we are so grateful for everything that everybody has been doing, but there's more, and we're really hoping that we can keep pressing on so that Sue and I don't have to make an appearance here next year and the year after that. Thanks. Sue, go ahead. You're on mute.
Okay. So my story is really very similar to Karen's. My husband, Gil, my late husband, Gil, I still call him my husband. I think that confuses a lot of people, but my late husband, Gil, he was diagnosed at 57. So I was in my early 50s when he was diagnosed. You know, at that time in your 50s, you're in the prime of your life. You know, you finally you're in a comfortable place. Financially, you've done all the big things, established yourself professionally. So we were ready to attack that bucket list. And unfortunately, our bucket list looked a little different than we thought it was going to look. You know, we were fortunate in many ways. Well educated, we were financially secure, and we didn't have children, so there was no worry about taking care of children's needs and college needs and all those kinds of things. But still, 10 years ago, the programs weren't available to us, and I'm sure Karen would agree with that, right? Our guys were younger than 65. Thankfully, a lot of that has changed now, so that people who are diagnosed under the age of 65 can access some programs, but the programs were not available to us. So we pretty much were on our own. And I have to say, you know, it's lucky that we were professionals, that were able to navigate the system, right? And we had enough time to navigate the system. And we knew what questions to ask. And a lot of people are not that fortunate. I come across a lot of people who don't know what to ask. They don't know who to turn to. They just don't have the skills that both Karen and I had, because we are well educated and we're not afraid. You know, we're not afraid to ask those questions, and we're not afraid to say to a doctor, hey, that doesn't seem right to me. But a lot of people are, you know, so I think that what I ask you for is to consider that, and to consider the systems of support that is still not in place for a lot of caregivers. So that relief, right? Caregiving is a day in and day out, 100% of the time job. You know, and people need relief from that, you know. So how do people access respite care, or how do people who don't have the funds qualify for a program? Where do they go? Who do they turn to? How do they navigate the system? So a concerted effort. To me, I think we need a concerted effort, a place where you can go and you can say, who can help me with this? And someone can say, okay, call the RES, call wherever, you know. People need to know how to do that. And so now I'm on the other end. My mom, who's in her late 80s, also, she's now in the mid stages of dementia, Alzheimer's. So I see it from a different point of view. And neither point of view has been a lot of fun for me. But both points of view have given me an appreciation for the work that still needs to be done for advocacy. So thank you very much for listening.
Thank you so very much, Karen and Susan. No matter when I hear your personal stories, and they are very personal, and I would imagine very difficult to share at times, but whenever I hear your personal stories, it is truly moving, but it's so important because those of us, or those who are listening, can understand that they also have other friends like you who have the same experiences that they do. And we absolutely will see a day, and it will be in the near future, where Alzheimer's is eradicated. The official goal is 2050. That's the federal government's goal, and that's the goal of the Alzheimer's Association. And we here at the Rhode Island chapter are very strong supporters of that goal. And it's because of people like you, Sue, and people like you, Karen, who share their stories, that we are able to get the picture of Alzheimer's and how devastating it is to those living with the disease and to their families. We're able to get that picture out to the public because of you. So thank you so very much. And we appreciate, again, everything that you do. With that, and it's really hard to follow, with that, I wonder if I do have somebody who is with us today, another very close friend of the Alzheimer's Association Rhode Island chapter. And I'm going to ask for Ben and his magic to work to see if we might be able to call our friend Mark Archambault on to say just a few words. Mark had sent a private chat.
We're working on it.
We're working on it. All right.
Mark, if you're listening to this still right now, Annie is sending you an email with the link to join.
That's great. Thank you so much, Ben. And I know that Mark would not mind my saying this. And we received a chat message from Mark explaining that, or notifying us that he is willing to talk for a few minutes. But for those of you who may not know, Mark has been an advocate for many, many years for the Alzheimer's Association. He is a well-known businessman in South County. He is a real estate agent and is living with Alzheimer's disease. Mark was, in fact, the first person in the United States of America to receive an infusion of a new drug called aducanumab, or Aduhelm. Once the Food and Drug Administration, the FDA, approved Aduhelm, Mark received the very first treatment, or the very first infusion, right here in Providence, or right in Providence at Butler Hospital, from Dr. Stephen Sellaway, who is a world-renowned Alzheimer's doctor and clinical researcher. So we are so very grateful that Mark is willing to share a few words about his advocacy and his experience living with Alzheimer's. And as soon as we can get Mark up on the video, we'll let him, or we won't let him. We are very pleased to have him share some words with us. In the meanwhile, what I would like to do, at this point at least, because I certainly don't want to, I'm very cognizant of your time, and I'm very cognizant of the time that our friends in the Rhode Island legislature are dealing with, particularly today, for the rest of this week and early next week, as I understand it. We, as a state, but the Rhode Island General Assembly in particular, is right smack in the middle of voting on or debating, discussing the Rhode Island state budget and wrapping up its legislative season, its legislative session in the next few days. So there is a flurry of activity starting today with a vote by the House of Representatives on the proposed Rhode Island state budget, which I will get to. That includes many items of interest to us at the Alzheimer's Association, but they are extremely busy, and we are so very grateful for those members of the Rhode Island General Assembly who have joined us. We will send out in our post State Advocacy Day report, which I'll send to all of you. I will also send to you a list of those legislators who are here with us so that you can personally thank them for spending some time with us and for everything that they do on behalf of the Alzheimer's Association and on behalf of the state of Rhode Island as well. So I will move directly into the meat and potatoes of what they're dealing with up at the State House now, which is legislation that affects our everyday lives, and legislation in particular, which we are advocating for and which affect those living with Alzheimer's and their caregivers. The process, for those of you who may not know, the process at the General Assembly is typically, well, actually not typically, by Constitution, the General Assembly begins its activities in January, and it usually ends by June 30th, which is the end of the fiscal year for the state of Rhode Island. It's the end of the budget year. And the budget is, in fact, the biggest piece of legislation, because it is a piece of legislation that the members of the General Assembly will deal with. It is the piece of legislation that has the most time dedicated to it, and it is the piece of legislation which obviously requires the most amount of money. This year's state budget is approximately $13.8 billion. $13.8 billion. So I guess sooner or later we're talking about real money here. But of that money, around $8 billion of it does come from the federal government, with another close to $6 billion coming from the state itself. And obviously that comes in many forms, or that is received in many forms by way of taxes, fees, and other money which the state generates. But a total of $13.8 billion is going to be spent on behalf of the state this coming fiscal year. The fiscal year starts July 1st and ends June 30th of each year. And I can tell you that by far the number one priority that the Alzheimer's Association Rhode Island chapter has this year, as it relates to the budget and as it relates to legislation and General Assembly activities, is to advocate for, as we have been doing for several months now, along with many, many partners, to advocate for an increase in Medicaid reimbursement for those who are providing care, in particular for those living with Alzheimer's and other dementia. And what I mean by that is an increase in what the state of Rhode Island pays via Medicaid for long-term care facilities, nursing homes, home and community-based services, and independent care. And these are all in part paid for by Medicaid, which is a joint partnership, as you probably know, between the state of Rhode Island and the federal government. The federal government gives the state of Rhode Island a great deal of money, a big pile of money, if you will, billions of dollars. And that is a part of our state budget. That is a part of that $13.8 billion that I spoke of. The federal government gives us these billions of dollars for the state to then determine how to spend the Medicaid money. We have to, as a state, we have to agree to provide certain services. We have to agree to provide to those who are in need in the state what the federal government believes are priorities. And a lot of that revolves around, again, long-term care, nursing home care, but it also involves care for children, for pregnant women, and for others who are in need of state support via Medicaid. There are literally dozens and dozens and dozens, if not north of 100 provisions that the state Medicaid office must comply with by way of the federal government's instructions. So we need to use that money to take care of what the federal government says we need to take care of. But any money left over, we can then use as a state to go on our own and create initiatives through Medicaid that help others in the state of Rhode Island who may be in need. And by that, I mean initiatives like the one I'm about to mention and the one that I mentioned earlier was our number one priority, using Medicaid money to strengthen the long-term care, nursing home, home and community-based service, and independent care workforce. We want to make sure that the workforce, which is so desperately needed in the state of Rhode Island, is not only fortified, but strengthened. We want to make sure that we take the Medicaid dollars that are available from the federal government and put those towards paying CNAs, certified nurse assistants, homemakers, caregivers, and other firsthand workers who, if you will, are at the bedside of those living with Alzheimer's and those living with other dementias. And by the way, a lot of other things that require direct support. We want to make sure that those folks are paid the type of money that they need to be paid in order to stay in that very, very important role. Now, I know you've all been watching the news of late, and I know it's hurt your pocketbooks of late and your wallets of late. The price of gas is the one obvious, but the cost of living in general has gone up by 8.6%. That is to say, the rate of inflation. I'm sorry, the rate of inflation is 8.6% year over year. That means, to use a basic example, you might be paying 20% more for eggs, as Donna McGowan mentioned to me yesterday. You might be paying 30% more for meat. You might be paying 80% more for gas. But I bet not too many people who aren't living with the type of consequence that Alzheimer's has on families, I bet not too many people understand that the healthcare inflation rate is far, far and above what the normal inflation rate in the United States is. So unfortunately, as inflation increases, the cost of keeping somebody in a nursing home or a long-term care facility or caring for them at home, those costs skyrocket as well. But what doesn't skyrocket is the pay that we are providing, not the state. The state does not employ these people directly, but the state helps to pay these employees. The pay for the employees who work in long-term care facilities, nursing homes, and who provide home and community-based services to those who are deep in need, those living with Alzheimer's and dementia in particular, the pay does not increase anywhere near the rate of inflation or the rate of healthcare inflation. The average salary, unfortunately, for those providing care is somewhere around $13.60 an hour. Some people get more and some people might get less. But that's the average rate that we pay to those caregivers. And that's simply an unaffordable wage, or that's simply an unlivable wage. As we all might know by reading the papers and watching the television, there is plenty of opportunity for those who might want to go to work for Amazon or Walmart or even a fast food establishment or a local convenience store or gas station, whereby those jobs are paying $16, $17, even north of $18 an hour. And we know how important those jobs are. We recognize and value those jobs. We certainly don't want to diminish their importance. But how much more important is it to pay our caregivers and to pay them wages that they can live on? That is our number one priority, making sure that the development of the Rhode Island budget includes increases in pay for those direct care professionals and also includes an increase in the rate that is given to the providers, if you will, the long-term care facilities, the nursing homes, and the home and community-based service firms, the providers. We want to make sure that everybody can stay in this business that they are in, which is so very important to all of us. Number one priority, and has been, frankly, from the day that the governor released his proposed budget. And with the help of the members of the House Finance Committee who voted on the proposed budget last Thursday, with the help of so many members of the House of Representatives and so many members of the Senate Finance Committee in particular, the leadership of the House and Senate. That is to say, House Speaker Joe Shekarchi and Senate President Dominic Ruggiero and their leadership teams. With the help of all those folks and the governor, I am so very grateful to say on behalf of the Alzheimer's Association that included in the proposed budgets are those type of pay increases. Perhaps not as far as we need to get to right now, but there are certainly guaranteed pay increases for those caregivers who are so important to taking care of those living with Alzheimer's and other dementia. It's written right into the budget. It will be debated as a part of the budget later this afternoon, and it will be voted on by the House of Representatives tonight. And we're happy to say that it includes some of what we wanted in terms of reimbursement rates by Medicaid. Very specifically, as it relates to year-over-year increases for those facilities that provide the care. Two separate things here, keep in mind. And I know it's very complicated, but there are the employees and their raises, and then there are the facilities and their increases in state support. And very specifically, the budget has included a 3% increase for home and community-based service providers, those firms, for long-term care facilities and for nursing homes. There is also support for hospitals, which on a temporary basis often have to deal with the same people that we are talking about. But a 3% increase is 3 times the increase that we saw given by the state in years past. And that's in part because of the inflation that we're experiencing. But I know that our friends in the long-term care, nursing home, and home and community-based services community are very grateful to the Rhode Island legislature and to the governor for proposing these increases. So as we, at the conclusion or past the conclusion of today's Advocacy Day, we will be sending to you all a snapshot of what we talk about here, a link to your legislator, a thank you, and an official ask, because it's not just the budget that we're dealing with, but an official ask, which I will talk about in the next couple of pieces of legislation. And the official ask is simply saying, because the budget is dealt with first, and then legislation that needs to be wrapped up is dealt with after that. So next week, in all likelihood, we'll be asking you to ask your legislators for support of certain legislation, which I frankly will talk about right now. And I know I'm doing an awful lot of talking, and I apologize for that. We have a limited amount of time. We're trying to get you out of here by 1 o'clock. Again, cognizant of the legislators' schedules today and cognizant of all your busy schedules as well. But we certainly want to mention some other important pieces of legislation that we are advocating for and that we will, again, ask you to ask your legislators for support of. And one of those pieces of legislation involves financial abuse of elders. In the state of Rhode Island, thanks to a law passed by the General Assembly, or a bill passed by the General Assembly last session and enacted into law by Governor McKee, it is now illegal to financially exploit seniors. And it is required of certain institutions, banking-like institutions, and also of state departments to report what they believe is financial exploitation of seniors. It is now mandatory to report that to the Rhode Island State Police, and the Rhode Island State Police then investigate and pursue, if necessary, criminal charges or otherwise. As you all can very well imagine, and this is terribly unfortunate, but those living with Alzheimer's and other dementias are often the victims of financial exploitation. So with the help of the General Assembly and the governor, last year we enacted that into state law. This year we're asking them to strengthen that state law. And we're asking them to strengthen that state law. And by the way, it has in fact passed both houses. It's passed the House and it's passed the Senate. We need to push to get not only all of you, but the legislators as well to, in fact, ask the governor to sign the bill into law. And that is to say, the bill that strengthens the already existing state law. And what do I mean by strengthen it? I mean, it sets the age, the official age of those who would be the beneficiaries of this law to 60 years of age. 60 years of age. The Alzheimer's Association asked for that change in state law, as did others, because we know that there are those who, like Susan described earlier and Karen alluded to, who have early onset dementia, and they are often under age 60 years old. And then there are those who are 60 or under. And then there are those who are age 60 to 65 who would not be covered under last year's legislation, who might have early onset dementia or who might be living with dementia in an early stage. Two separate categories. I know it's complicated, but bottom line, this legislation now makes it age specific to those 60 years and older. You cannot take advantage financially of anybody age 60 or older. And if a bank or a banking institution, a financial institution, or an arm of state government believes that you are, then it is mandatory they report that to the state police. So we're working on that legislation as well. And we certainly hope that gets signed into law by the governor. I'm going to also mention something that is being debated today by the House of Representatives, also included in the budget, and that is to say, what I described earlier about Medicaid reimbursement rates. It's every single year that the Rhode Island General Assembly sets those reimbursement rates. So each January, if you will, when the governor proposes his budget, when the legislature begins debating, they have to go back and look at what the reimbursement rate for long-term care facilities, nursing homes, and home and community-based services providers were in the year prior. And then they decide how much more of a rate increase, or in great financial times, they might keep it the same. They might give level funding. But nonetheless, they have to come back every year to discuss that. And one of the things we advocated for, and Representative Kazarian and Senator DePalma and Senator Felag were great champions of this in the House and Senate respectively, was to have a process required by law, found in the budget, but required by law, which will have the state Office of Health Insurance Commissioner, along with the Medicaid office, meet yearly to look at what the rate of healthcare inflation is and report back to the governor and the legislature on what is an appropriate rate of increase, rate of reimbursement, so that these facilities and also these workers have to bite their nails, if you will, every single year and go through the nerve-wracking process of whether they will have enough state support and federal support to stay in the business that they are in. Of caregiving, we know from a national report from the Alzheimer's Association that in Rhode Island specifically, there is a 26% shortage of caregivers, professional caregivers who work at these facilities and these home and community-based service providers. We know there's a 26% shortage, and we also know that there is a drastic shortage of nursing home beds and long-term care facility beds. And many facilities are in danger of closing. So this is the type of thing that drives these employers and employees to be extremely nervous at the start of every year as to whether they'll have the funding. So we are supporting, again, a mandate that the insurance office and the Medicaid office of the state provide reports each year to the General Assembly and the governor, which recommends what they believe is a necessary increase in reimbursement. No more guessing. It will be there for everybody to look at, and it will take a lot less of a burden off of the providers and the employees. So we're looking for that to be enacted as well, and we will follow up with you via email for your asks. The last thing I want to do, and I'll do this within 2 minutes, I promise, because I now then need to pass it off to my colleague. But the last thing that I will do, is I will mention a tremendous victory that we already have, which frankly, a lot of us in the advocacy community for elders and the advocacy community for long-term care and for home and community-based services were quite concerned would not happen. But in a nutshell, we scored a major victory when the House of Representatives reinstated money that was essentially a surplus from Medicaid funds. They reinstated into the budget what is called Perry Sullivan money. And you don't need to write it down or remember that name, but it is named after two former legislators, one who sadly passed away, the great Rep. Ray Sullivan, but it is named after them and has a specific cause. And that cause is in the state budget each year, as we finish the fiscal year, if there is money which is left over that had been designated for nursing home beds, for nursing home reimbursement, or for long-term care reimbursement, if there is money left over because the expected amount of rooms or beds were not used, then that leftover money is supposed to be taken and directly given to home and community-based services funding in the state of Rhode Island. And the reason for this is because the state has a master plan that the Alzheimer's Association worked on, which would shift folks, unless necessary, away from nursing home care, where at all possible, they are able to be taken care of at home. So that takes a lot of money, but this excess or surplus money that's left over from a lack of room use or a lack of room use or a lack of bed use at nursing homes, any leftover money that the state originally gave for that purpose is supposed to go to home and community-based services. And this year, it was taken out of the budget at the beginning of the budget process in February. So we are very, very grateful that the Rhode Island General Assembly has reinstated that money for home and community-based services to the tune of approximately $30 million, almost 18 million, 17.7 of which comes from the state, and the remainder, 12 million or so, comes from the federal government. It's all part of Medicaid, but $30 million, thanks to the General Assembly, the Rhode Island House Finance Committee in particular, thanks to them, $30 million will be reinvested into home and community-based care for the calendar year beginning July 1st, 2022, and ending June 30th, 2023. So a great big thank you to them, to the General Assembly, again, for all of those legislators who are here with us, for sharing your time, to the governor, to the lieutenant governor, and everybody involved with the legislative process. Thank you, thank you, thank you for everything you do for the cause, for those specifically living with Alzheimer's and other dementia, and for their caregivers, for their family and friends who care for them, and for their professional caregivers as well. We certainly could not do it without you. And what I'll be asking at the close is another reminder, if you will, of what we'll be following up on and what we'll be asking you to do. But for the time being, as we get close to closing out for the afternoon, I'm going to turn it over to my colleague, Annie Murphy, who is the program director at the Rhode Island chapter, and she's going to talk a little bit about our work in the community and how we advocate politically and otherwise in our cities and towns. Annie, take it away.
So good afternoon, everybody, and wonderful job so far, David. Thank you so much. I'm here just to remind everybody that June is Alzheimer's Brain Awareness Month. And during the month of June, our chapter is putting together community forums all over the state of Rhode Island and all of our towns and cities to give each one of you and anyone who's been affected by Alzheimer's disease or truly believes in this cause to come to our community forums and to talk about your experiences, what it has been like, potentially, caring for someone living with the disease, how you have found the necessary, resources and supports, or maybe not. We want to hear how it's going in your communities and how the state of Rhode Island and everybody who is joining us to improve the care and support right here in the Rhode Island. What are your needs? So we have scheduled 4 community forums in Warwick, South County, East Providence, and Newport. And our first community forum is taking place tomorrow morning in Newport at Edward King House at 9 a.m. We will be sharing with you, if you haven't already registered, we will be sharing with each one of you who's registered for the community forums we'll be sending you a flyer that you can actually to self-register. And then we also ask if you're living in a particular community where a community forum has not been scheduled, reach out to me. You can reach out to me on my email at mmurphy@alz.org and help us bring a community forum into your community so that we can learn more, we can understand, and have better ideas of how we can bring the community education and supports that are needed for your family members in your particular community. So thank you very much for listening to me, and back at you, David.
Thank you, Annie, so much. Annie has held my hand for these last few years. I've worked, unlike Annie and Donna, I have only worked in the age of COVID with the Alzheimer's Association. I'm very familiar with the advocacy world. I've been doing that for a long time, but as it relates to Alzheimer's, I've only been working in the age of COVID. So Annie has been holding my hand with regard to providing these types of support in the community and how we can ask all of you to advocate with us through those forums and in other ways. So at this point, as I promised earlier, and we do have them now, according to Ben, I'd like to bring on just for a couple or 3 minutes, if he could, our friend, Mark Archambault, who is extremely, if I might say so, Mark, brave for sharing his personal story with all of you and frankly, with the state of Rhode Island and anybody else who will listen. And we are very, very encouraged that you're willing to be a voice for those who need it the most. And we're also very thrilled and thankful, Mark, that you can spend a couple minutes with us here talking to our attendees and the legislators who are attending and anybody else that might be on from state government to share your personal story, Mark. If you will, welcome, Mark. Support in the community and how we can ask all of you to advocate with us through those and in the way. So we do have that. I'd like to bring up for a couple or 3, if you could, our friend Mark Archambault is
Mark will be with us in just a second. I think there's a little bit of a delay on his end.
Okay. All right.
'Cause I
Mark,
can
hi.
hear it.
Yeah, I think he's on mute also, Ben, if we
Yep.
might be able to get him off of that.
Yep, he is off of mute. He will be back on in just.
Encouraged that you're willing to be a voice for those who need it the most. We're also a couple minutes with us talking for attendees and the legislators who are attending. Might be on state government.
I've never seen a connection that far behind, actually.
If you will,
Am I ready to talk? Hello, hi everybody. I'm happy to talk about Alzheimer's because I have it, and I've been dealing with it for 7 years, and I knew something was wrong before that.
also, Ben, if you'd like to get him off of that.
Yep, he's off of mute. He'll be back on.
Yeah, there's something going on. Can you hear me?
Mark, I think we're having difficulty with regard to what seems like a slow feed, and I apologize to you, and I apologize to those who are listening in and watching. But what we'll have to do, Mark, is we'll have to have you on for another segment in another follow-up forum in the summertime, one of our community forums or something of that nature. I really would have liked to have had you on to share your story about living with Alzheimer's, but I'm so very sorry that we have some problems with the feed. So folks, for those of you, again, who might not know, Mark Archambault has been an advocate with us for at least 7 years and has been living with the disease, as he said, for 7 years. And Mark is a terrific advocate for us in sharing his story and in giving interviews to local media, to national media for that part, or for that saying, as well as traveling to let others who are living with the disease and their caregivers understand that they are not alone. So Mark, I'm so sorry we could not have you because of the technical problems, but thank you for everything you do for the cause and for the chapter in particular. All right, so we are wrapping up here. I thank everybody for being with us, but I'm going to ask Ben to pull up that document that I sent earlier, if he could. I know I talked about the 4 pieces of legislation, but there is quite a bit more that we follow during the legislative season or the legislative session on behalf of the Rhode Island chapter and with our other partners in the community. Many of our partners are supporting some of the pieces of legislation that are outlined here. You can't necessarily see them, but this is the type of document that I will be sending to you in a follow-up. We are following at least 23 pieces of legislation, including, of course, that all-important budget for the Alzheimer's Association Rhode Island chapter. And we're not going to ask you to advocate on behalf of all 23 pieces. Sometimes you win, sometimes you need to come back for more advocating the next year. We're going to be asking you to ask your legislators for support of maybe 5 pieces of legislation at most. And some of those pieces I discussed earlier, and some of them we just put up on the big screen, and we will share with you later today or tomorrow or early next week, depending on how the legislative session moves along. But we're going to once again be asking you to ask your legislators by way of a very easy to use piece of technology. We'll send you an email and we'll send you a link directly to your state representative, to your state senator, and to the governor. And we'll be asking you to ask your legislators for support of the legislation, which we will outline for you, some of which we spoke of earlier today. And it's a very easy, again, process for you to involve yourself with. It takes about 30 seconds simply to log on to email, enter your email address and your name. You'll be matched to your legislator. Everybody has the same governor, of course, and Governor McKee, but you'll be matched directly to your state rep and your state senator, and your email being sent to them will be an ask on behalf of the Alzheimer's Association community here in Rhode Island. So thank you for being with us today, Thank you for all the advocacy you do for us live and in person or virtually. Thank you for the care that you give to those living with Alzheimer's and other dementia. And thank you, frankly, for being a friend of the Rhode Island chapter. If Donna is with us, which I hope she is, I would ask her, and I'll put her on the spot. I apologize, Donna. I sometimes do this, but I would like to ask Donna to perhaps close us out with just a few remarks from the heart. Thank you all again.
So I'd just like to thank everybody again for taking time out of their very, very busy schedule for this very, very important discussion. As Karen Friend mentioned, we're very progressive in the state of Rhode Island. The chapter is exceptionally progressive. Our volunteers are exceptionally progressive, and it just goes on and on and on. And that's why we've been able to accomplish so much here in the state. You know, we had a state plan 5 years ago on Alzheimer's disease and related disorders, and we've just been growing and expanding upon that state plan. And we're not going to give up or give in. We are relentless, and we're going to keep going until we can find a cure or a protocol for this devastating disease. That's our mission and our vision. And I want to thank all of you so very much for helping us get our job done, because without you, we wouldn't be able to accomplish everything that we have. And I want to wish nothing but health and happiness and a good summer for all of you. I hope that you will reach out once you receive the links and reach out to your own legislators. If you have any questions on anything that was discussed today, please reach out to us at 1-800-272-3900. You can email David Carlin at drcarlin@alz.org, or you can email me, dmcgowan, MCGOWAN @alz.org, and we'll get back to you as soon as possible. So again, thanks for sharing your time. Thanks for sharing your energy and your effort. And please all stay safe. Thank you.